community. And so Project Health actually exists in 6 different cities around the nation, including Boston, Providence, New York, DC, Baltimore, and Chicago. And so if you're interested in volunteering for Project Health, you can go to any of these cities and these opportunities are available for you. Boston Project Health is actually a number of different services that are available to these families through population, including, which was my job, food pantry, big office, DTA for food stamps, a free prescription pharmacy, free housing seminars, and US, which were social service help desks that were dispersed throughout the medical center. And there were 4 different help desks. There was the Family Help Desk, which was specifically for children, Project Baby, which helped mothers in the maternity ward, PEDE, which helped children in the emergency room, and Women's Resource Center, which is where I worked, which was in the OBGYN clinic, which was for pregnant women. And so the idea of having all these resources within the hospital is that your health spans a lot further than the care that your doctor can provide you. It spans a lot further than whatever prescription you're being offered. There's so much more. What you eat, where you live, the care that you give yourself. And so Project Health looks at this holistic view of health and brings it to the hospital. And so the beginning of Project Health is a really wonderful story. Rebecca Oni, who's the woman in the picture, she was only a sophomore in college at Harvard University when she founded this organization. And she went to Dr. Barry Zuckerman, who worked at Boston Medical Center. He was a pediatrician there, and said, I have a wonderful idea to help children improve the health in America, and it's a revolutionary idea, I want you to help me. Now normally a physician would be like, this is crazy, I'm sorry, but I have a lot of work to do, but he really saw vision in what she was saying, and so they worked together to create this organization that is now all over the nation and really is impacting hospitals and families. And also, Rebecca actually works in Boston, which is the headquarters, because that's where it was founded. And it's wonderful because she came and spoke to us a lot and gave us lectures, and it was really inspirational to hear, why she started this, what she really believed. And so we were kind of working right next to the person who had all these ideas, and so that was very inspirational. Okay, so there were 4 components to my internship. The first was shift, and that was by far the largest component. And then we did research for asthma needs assessment. There was the Summer Polytech Institute, and there were reflection sessions. And so the first part, the Women's Resource Center was located, like I said, in the OBGYN clinic. And so what happened is, it was in a waiting room, so all the women would sit in chairs and face my desk at the Women's Resource Center. And at this desk, there were lots of signs such as, like, are you in need of jobs? Do you need housing? Do you want information about discounts on utilities? And so the women would be sitting here looking at these signs, and maybe something would catch their attention, and they'd walk over and look at flyers and answer questions, and that's how we found a lot of our clients. Another way that Project Health works is that when women actually go into the doctor's office, the physician will ask them questions about their health, and at the same time they'll say, well, how is food at home? How are these other issues? And if there are social issues that they really aren't supposed to deal with or aren't qualified to deal with or don't feel they have the time to, they write a referral to Project Health, and they say, Francesca, I want you to talk to this woman because I don't have time. And so it's a great way to actually get the doctors and the nurses and the healthcare providers involved in the process. And actually the way Project Health expands is really interesting because the doctors that are trained at this hospital move to other places around the world and say, hey, I can't function without a family help desk, so I implemented one, and that's kind of how this organization grew. So who we serve, we primarily serve pregnant women. All of our clients that we helped were of a low socioeconomic status, so they were in need of financial help. And so the issues that we faced there were numbers of different issues. The most common was housing, because there's a horrible housing crunch in Boston, and that was the biggest issue and the hardest because it doesn't really have an immediate solution. So we dealt with housing, food, utilities, discounts, childcare, public benefits, jobs, health insurance, car seats, and commodities. And that's just a list. We had a plethora of resources at our fingertips, but we're always encouraged to keep researching and keep finding new ones because that was our job, to know the resources and to be able to impart it on our clients. And so a typical client experience would be a woman is sitting in the waiting room, she sees a sign that catches her eye, she comes over and perhaps I'm sitting down and she says, "Hi, I have a question about housing, I saw this is interesting." And so I would invite her in and I would take down her information and we talk about housing. I would explain all of her options to her, Section 8 vouchers, subsidized, market rate, etc., because it's really confusing, and that's one of the most important parts, was to make sure that they just understood the system and understood all their options. And so then I would help them apply for subsidized units. I would make sure, Xerox copies of numbers and make sure they understood how to go about the process. And that was the most important part, was enabling them so they understood how to do it, so they could go home and do it themselves, giving them that power. Then I would kind of delve further and ask them more questions. So she came in just with one question about housing, but how is food in your house? What are you paying for your utilities? Do you get a discount? Does your child have a place to go? Just kind of these questions. The more I asked these questions, I kind of learned more that it's not one problem that these women were facing, but plethora of problems. So one kind of followed the others, and sometimes if you learn multiple areas of a person's life, you can kind of shift, well, maybe she could pay less in one area and put more towards rent, and then her housing would be secure. So it was more of a puzzle than kind of a yes or no, black or white answer to deal with. And so I established long-term relationships with about 25 women over the summer. And so that means I met 25 women and I consistently called them and I worked with them thoroughly. Now that doesn't include the number of walk-bys who just came in for a simple question, or I sat down but didn't take their information because they didn't really necessarily want that long-term relationship. And so I was just one of 20 volunteers. So you can just imagine how many people we worked with over the summer. And the goal is to empower women, because if we can lessen the stress in their life, then they'll more adequately be able to take care of their children and be able to start their families in a more healthy way. Okay, so Project Health Impact, these are just a few facts that I took from the website. Over the past 5 months, 205 families found housing, 154 clients placed their children in child care, and 135 clients connected to food resources. Okay, so the second component to my internship was research. So I did asthma needs assessment with a doctor from the Children's Hospital in Boston. And so together we kind of discussed the question, would a resource desk designed specifically for asthmatic children benefit the community at BMC, at Boston Medical Center? And so with her, I interviewed lots of families who had asthmatic children. And Project Health actually has other organizations where they do swim tests and swim programs for children who have asthma. And so I talked to these families and I created surveys to implement this semester to see would a desk benefit children with asthma. Okay, and so then thirdly, we had the Summer Polytech Institute, which were bi-weekly lectures and discussions on issues of public health. And that was really interesting because they would invite lecturers to come and we just they would present, and then we'd have a discussion. And our most famous speaker was the economist David Cutler, and he talked about healthcare with respect to the economy. And it was really interesting because it was a perspective that was different from a lot of the other ones that we heard. And then finally, we had reflection sessions, which were weekly meetings with our program coordinators to discuss difficult issues, because, like I said, nothing was black and white. There wasn't one way to help a person. So if we talked about it, sometimes other people had great ideas that we didn't necessarily think of. There was also program development, and finally statistical analysis, like who are we impacting the most? Where do we need to put more research into? How can we better our program? And finally, Project Health and the Hepburn Center, how do they go together? Well, the focus of the Women's Resource Center was on women and their families, and the Women's Resource Center also empowered women by giving them the resources to succeed and connecting them to the community. And we also targeted women in poverty, so those who are at a disadvantage already. And so this connects to the Hepburn Center on several levels: civic engagement, women's health, social justice, and just empowerment of women in general. And so then Project Health in my career. Project Health gave me exposure to a clinical setting, which was wonderful. I worked in the hospital every day. It exposed me to public health and social work. I learned a lot about the Massachusetts healthcare system because I was in Massachusetts, and it's very different than the way a lot of different states operate. I also learned a lot about the US healthcare and how it compares to other nations and what we do and what we don't do. And mostly I learned about issues of poverty and health in urban environments, and just when you really can put socioeconomic labels on a population, what that really does to their health. And that was probably the largest thing that I learned. And that's it. Thank you.